Welcome to the podcast for Healing Neurology, where we talk about everything that can help heal your neurology, which is really everything, from food, lifestyle, and medicine to nature, culture, and politics. There's no topic too big or too small. I'm Jillian Ehrlich, family nurse practitioner, certified in Ayurveda and functional medicine, and we have a real treat for you listeners today because we have our clinic nurse, Naomi Pascoe, here with us to talk about her coaching programs, which pretty awesome service we're starting here at Center for Healing Neurology. So Naomi earned her BSN from Grand Canyon University in 2016, and she also holds a bachelor's degree in communication and is a certificate graduate from Coach Training World. She is currently pursuing an advanced degree in nursing and certification with International Coach Federation, ICF. She did and is doing all of this as a single working mom, so she gets it. She deeply gets the challenges of trying to focus on self-care amidst the reality of a busy life, parenting, and working. Her passion has always been health, and she learned that what we do in our daily life so often supersedes much of the information we get in a doctor's office about getting and staying healthy. Naomi says self-care is the new healthcare. Naomi sees coaching as the collaborative way to help get yourself back on track. As a nurse, she seamlessly blends the science of wellness with the art of encouragement and accountability. It's all about possible mental paradigm shifts and getting the results you want. Today, we dive into what this process is all about and why we are adding it to our cadre of services at Center for Healing Neurology. So, Naomi, thank you for being here with us.
Yeah, thanks for having me.
So we know what nursing is. Most of us know what nursing is, and it is one of the most trusted professions. I say this as a nurse still with an RN license, as well as a nurse practitioner. So we know what you do as a nurse, but what is a health coach?
So I'm excited about health coaching. I feel like health coaching is a collaborative, very supportive role. And what's great when you interject it with the healthcare profession is I think that it links the knowledge and education that a provider as yourself gives to the patient and the actual action that the patient, or in this case, client, needs to take to get to that goal or health trajectory that they're looking for.
Talk to us about what the coaching process looks like.
Yeah, so the coaching process, it's mostly, at its fundamental, it's a conversation. It's a type of conversation that's had between two people. Within this relationship, there needs to be a lot of trust because I'm asking the client to get pretty vulnerable and in touch with themselves. As we know, health is not a point of being. It's kind of a journey, and it doesn't happen on accident. I think that true health really is a day-to-day choice that we make, and it needs to be more intentional the older we get typically.
So it's a conversation, and one of the things that you had mentioned a little off air before when we were talking was that health coaching is a particular type of coaching.
That's right. Yeah. So life coaching, is kind of the umbrella term, and underneath that there's a ton of different types of coaching. Once you get into a relationship with a coach, a life coach, a health coach, they're all so similar, and I think the reason is because everything is connected. You tug on anything and you find that it's connected to everything, whether it's health, business, relationships with self, family. So health coaching, it isn't just about health necessarily, but everything else that goes into a healthy lifestyle.
And so do you go all those places with people?
I do, yes, I like to. And especially in the first couple sessions developing this relationship, I like to use a few tools that helps build the trust. They're fun. I think they're fun. But it's looking at all the different areas of life where there's dissatisfaction or a loss of connection. And my thought is that if we can increase the areas, all these other areas of life, like I said, finance, relationship with self, relationships with family and friends, sleep, and, the happiness of your environment at home and at work. So if any one of these are off balance, if you can increase the satisfaction in one, the health area will almost automatically go up, either directly or indirectly.
What a cool experience. And so it sounds like your first introduction with patients or with clients, what people are really going to be stepping into is a supported and assisted kind of a hand-holding to be reflective on their life.
It's true, yeah. I heard life coaching compared to the role of a mountain guide. And so, my job here isn't to do the hike for you or, the mountain climbing rather for you, but possibly help you figure out what route you want to go, because there's multiple. And then I like the idea of letting you know when your footing looks fantastic. And when you're getting in a little trouble, or maybe, this is a little bit too big and we need to take smaller bite-sized steps to get to the top, to the pinnacle.
And how did you get into health coaching?
So I was in a transition in life maybe 10 years ago, and I actually hired a spiritual coach, and I just had so much growth out of that experience. And so since then, I've just been turned on with all areas of life coaching, and I've done therapy as well. And I just find that with the exercises and expectations of the relationship with the coach, I get so much more out of it in terms of my mental health.
And so how come these aren't things or tools that people can kind of just do on their own?
They can. They absolutely can. And I think what the difference is with having a coach is to kind of keep you accountable. It's the same as when you hire a personal trainer. It's like if you have signed up to pay $40 an hour with a personal trainer every Tuesday at 2:00, you're going to be there at 2:00 and you're going to do the thing. So it's something you can do. You can pick up a book, you can read, you can listen to podcasts about, these things, but the coach is there to keep you accountable. And the word accountability almost doesn't resonate, because it sounds very much like a punishment. And I don't want people to think that, with health, it's like there's so much negative connotation, and it's not about, it shouldn't be painful to be healthy. It's just about, maybe having somebody to bounce your ideas off of. Validation, I think, is really important, especially if we don't have those supportive roles at home or supportive people to tell us, like, you're doing great, I believe in you. So the health coach is really there for a lot of different social reasons.
Yeah, and that's very true. What I know, that your personal trainer analogy is perfect, because what I know about myself with exercise is if I have somebody waiting on the other end, then I do show up a lot more completely.
Right.
And I think if you have a certain amount of time also, that, a set window, then that window is where you can kind of step out of your usual ways of being, and you have more flexibility in your mind to be creative, to think about your life differently. And those are the places where it seems like change can really happen.
That's right. Yeah. Some of my clients, it's neat to hear them, they're working all day, they're working from home, in the same space as their family. And I ask them, can you please step into a different room and just take a deep breath? And it's just really expansive, the way that they just allow themselves, and with the invitation that they can relax and kind of get a little bit introspective.
So we do need that sense of attention in to kind of look at ourselves, and then attention balanced with attention out. And then we do need kind of physically that sense of we're in one place and then we're in another. We really do have, I think humans really are built on this polarity. And so having a coach or support is really mimicking the humanness of that polarity that we feel. But I've been thinking about this recently, because I've been explaining how when babies are born, we don't have any twinkle in our frontal lobe for the first 6 months of life. So we really rely on the frontal lobe of our caretaker to give us an understanding of what's happening. We really the phrasing goes that we borrow their frontal lobe. And so we really are meant to align with the neurology of others. So you have done all this work on yourself, and now you're making yourself available for people to align to you so that you can be in a relationship which is reflective and helpful and supportive and accountable.
Yeah, and I would love to see more people be able to have the health and tools to achieve health, even amidst, the craziness of life.
Is that possible?
Absolutely. Absolutely.
How do you do that?
Well, I think
look like?
I think that we have to be gentle with ourselves, and that not every day is going to be great. And just to have our routines and know that there's going to be ebbs and flows with how we feel and our health. And like I said, I think being gentle and forgiving of ourselves, and just being okay with not having great days.
Tell us a little bit about kind of your training and some of the exercises that you use with people.
Yeah, so one of my favorites introductory is called the Wheel of Life. And with this, on a 1 to 10 scale, I ask people to rate how they see their health, finance, spirituality, or religion, whatever resonates with them, relationship with others. There's a few others that I think I'm forgetting now, but I think that's a great starting point. So I asked them, a series of questions for each one. Why did you rate this a 3? What would be an acceptable number? How do we get there? How do you know when we get there? What would that feel like? And so forth. And it's a small exercise, but it really can be stretched over a series of sessions, just because it's so so rich and, as our lives are so rich and so complicated. I really love journaling. I think I ask a lot of people to, in some instances, I think it's important to do homework and self-reflect and keep this going. So there's lots of different journaling type exercises that I suggest as well. Mm-hmm.
And what's interesting about you being a health coach is that you also are a nurse here at Center for Healing Neurology. So where does the science of the neurology and the neurological components that we talk about, where does that come into your practice?
So, I have it in the back of my mind as to why it's important. And I don't like to interject those things to the patient with the idea that most clients or patients in this case have been exposed to the different concepts of health. So what I feel like I want to do is just kind of tease out what they already know and what resonates with them and what they might be ready to act on.
Yeah.
If they're asking me certain specifics, that has to do with science, lab values, what do you suggest? I don't mind giving my 2 cents, but I do like to say, okay, this is my nurse coming out right now. So there's clear boundaries in terms of where I feel the conversation needs to be if we're going to call it a coaching session.
So it's interesting to try and figure out how to balance that kind of health literacy piece versus the coaching piece.
That's right.
And so who's a good person ready for coaching?
I think that, it needs to be someone who's flexible in their mind and ready to make change, not scared of change necessarily, ready to play a little bit and get vulnerable. Essentially anyone. And the unfortunate part to coaching is people already need to be in a certain mindset to get there. And I think that coaching can help people get there. But of course, they have to make the first choice. I think it can be someone who's already healthy and just wants to get to the next step of health, whatever that means to them, or someone who really is already in a chronic state with multiple comorbidities and they just want to learn how to manage those in a way that helps them get the best out of their own lives.
And what's the right time? This question also partners with what's the right time?
Anytime. Absolutely anytime. I know that is a very short answer, but I do think that the growth is why not now? Why not now? So
the mountain climber analogy is so perfect because it's kind of like, when is the right time to start climbing a mountain and that really is anytime.
And it's just one step. Yeah. You just step in that one direction and you're already climbing that mountain. It doesn't have to be, a triathlon. We don't need to think about it like that. We just need to take the step in that direction and it doesn't have to be steep. We can go nice and narrow and take as long as we want.
What happens when people get overwhelmed kind of inside the process of coaching?
Yeah, and I think that's possible and it happens a lot, especially when we think about health and any goal in like a big picture item. And one thing that the coach is to do is to help people take the small bites. And that is for the big picture thinkers. I think the way people think, some people think in smaller bites and it's easier for them. And I'm there to kind of help them see the big picture and find that goal. Likewise, if I'm dealing with a big picture thinker, we need to talk about what are the bite-sized steps to get there. And then with meeting with people every week, it's a nice time to recalibrate on the goal. How are you doing? Was the exercise that either they proposed or I proposed for this week, is it too big? Was it not enough? How did it feel? Is that what you want to work on right now? Do you want to shift gears? Because all that's okay.
Yeah, this sounds so fantastic. This is perfect for kind of the darkness of the winter. It's a good time to be reflective and plant seeds for the spring. Ordering your seeds is what we do for the garden in the winter. And it sounds like this is part of that process of figuring out what are the seeds you want to plant to grow in the spring. What are the plants you want to harvest next summer? You got to start with the seeds. So,
I love that.
Yeah.
I love that.
So we've talked about the life wheel and we've talked about health coaching versus life coaching, but what are some of the goals that people go for with health coaching?
Well, I think that people tend to be nervous about health coaching and it just depends. Everyone's so different. And like I mentioned with the way people think, some people want to lose, 100 pounds. Other people, really want to look good naked. Others just want to learn how to manage their diabetic medications, or, medications in general. So others want to feel happy. So there's so many different factors, and it just depends on how people think about health and wellness. It's just different. They think about health and wellness in a different way. So it just depends on how they're thinking, where they're at. It really is just so individualized with goals. And during the first chat, the introductory appointment that I like to go over, I do like to figure out what they're kind of thinking it is, what they think they want, what they do want, what they might be open to.
So can a person's goals change during the coaching process?
Absolutely. And I think it's natural for them to change within the coaching conversation. I do like a large amount of flexibility and fun. And so within that, I think it's perfectly normal to switch goals, just like life. I mean, I don't think life is terribly black and white. There's so much gray area. And once you make a goal and then you realize, wait a minute, it's not that I want to lose 20 pounds. I just want to feel good naked. And so that doesn't necessarily,
I love that.
Yeah, it doesn't necessarily mean a loss of weight. It just means maybe toning up a little bit and, some thought work and maybe turning the lights down a little bit low because everybody looks great naked in the dark, and just
loving everything just as it is.
As it is, yes. And how a great night of sleep will automatically make you feel, a little bit better. And so I think it's perfectly normal that goals shift and change, and I think it's healthy.
And so what is the process? Like if you sign up for coaching, what are you signing up for?
Here at Center for Healing Neurology, we decided to do 8 coaching sessions, and we decided that to help any habits that might need to be shifted, but also since there does need to be a level of trust and intimacy between myself and the client, it takes time to build that. And also sometimes people need to learn how to trust themselves and kind of get in the flow of what this conversation looks like. And introspection can be new. So there's so many different factors that can take place. And looking at different areas of life, if someone feels stuck, I might ask, how does your closet look? Maybe we can start by decluttering that, and it's an exercise that allows to make space that might trickle into other areas of life to get kind of unstuck. So it can just really flow into, these conversations can flow into such vast areas of someone's life and lifestyle before they really start seeing it affect health necessarily, outside of maybe mental health.
And so is it weekly sessions?
Yeah, 50 minutes once a week.
50 minutes once a week. Can people do every other week?
I think so. And I think that should be based on how well they're doing, I think. But absolutely. I wonder if even, weekly sessions are every other week, and then it could be just a monthly check-in if they feel they need that support or they just really love their relationship and they see value.
There's another process that does week sessions, which is therapy, but this is not therapy. What's the difference between coaching and therapy?
I sense that therapy is more about the past and traumas and how we are kind of replaying some of our coping mechanisms and how we're showing up and to identify those so we can kind of change them. Coaching has more to do with the future and what we want to get out of life. And they are very similar though, because we do need to kind of shift some of our patterns sometimes if we want to move forward. So a lot of these topics that people bring to the table can be addressed both in therapy and coaching. However, the conversations around each topic are going to sound quite different.
So what I love about this is we do conversations about health, true health. What we're trying to do is go further and further upstream. And when you go further and further upstream, then you get into some very esoteric or some very subtle topics. And you can even get into things that are kind of aren't real. People talk about influences from even intergenerational, they're very real, but it's hard to translate that into behavior. And so it seems like what you're talking about with coaching is really on the ground behavior, that this is a very physical understanding about what you do with your body and your mind on a daily basis in order to reach for your goals.
Yes. Yeah. Habits and intentional and consciousness.
On the ground, like in this physical body, I will do these things with my body to keep myself healthy.
Yeah, let's pay attention, which is hard, right? It's hard in the world that we live in today with so much distraction and we're so busy and tasks with work or to keep food on the table or the kids in line or all these things. So
And you've been doing all of this as a single working mom.
Yeah. So, and a lot of people do. What I've noticed, so I'm working right now, I work with a coach and a therapist. As you know, my son was diagnosed with schizophrenia 3 years ago. And when he got sick, I just realized that I really need to take special care for myself and my health, mental health, rather. So in that, I know what I need to do to keep myself mentally healthy, and it's movement every day. It's healthy food. I need to get a certain hours of quality sleep. I need laughter. So that means that, I need to be feeding my brain certain content that I find funny. I like to, surround myself with people that, are a joy to be around, and, healthy working environment. So there's so many things that I knew that I need to take care of for myself, so I don't wind up in the cuckoo nest, and I can better take care of my son who needs lots of support.
Are you now a coach because you have it all figured out?
No, I feel that I'm in a place in my life where I'm ready. Coaching was something that I've been thinking about getting into it 10 years ago when I first experienced my first coaching session as the coachee. However, I just feel like I'm just in a better place to facilitate being the guide, I suppose. I guess it is about readiness, but a certain amount of healing that I've done that I feel confident, I suppose, and possibly I was ready then. I just didn't see it.
Watching you work with your son, the time that we've been together here in the office has just been tremendous. I just want to say I see your struggle so much, and I have so much respect for how you continue to show up for yourself, show up for your clients and your patients, and show up for your son. It's such a load.
Thank you.
And I think that I can see that translating into your coaching work, because you don't come from a place where you can have it all, or you don't come from a place where there's not going to be any heartbreak. You come from a place where things will be good and things will be hard and things will definitely be unpredictable, but that you want to just keep, sometimes, we talk about it, keep that pointing and moving forward. That's the mentor I had when I was in my early 20s used to say, it doesn't matter how quickly or how efficiently you get somewhere. It's just you do the best you can, and you just got to keep the pointing and moving forward. And so I see you approaching everything you do like that. So I'm so impressed.
Thank you. Thank you.
So what else do patients or do clients need to know about either coaching or in preparation for doing their own coaching program?
Yeah, so I invite everyone just to book one session with me. The first one is free. It's an introductory session. We can chat more about what health coaching, what life coaching is, what they might be looking for, and to see if it's a good fit. I sense that until someone takes that step for themselves, it's really difficult to know where this new kind of teaming modality might benefit someone. However, I do feel passionately that it can help everyone.
Naomi, thank you so much. It's been really fun to chat with you about this thing you're so passionate about and get to know a little bit more about it. And I'm excited for patients to be able to take advantage of your time and attention to help them get their lives together.
Yeah.
I shouldn't say that. I mean, we all have that. I need to get my life together too.
Just create some more richness and a little bit of expansion.
Yeah.
If anything.
Yeah. I think having a weekly time to step out, to go in with an intention, to have a topic, to have some goals, to be able to step out of your daily life and step into a relationship that includes some reflection, I think is so important for having a life that is the life you want, the life you're intentionally making. So I'm excited you're offering that to folks here. So if you are interested in talking more with Nurse Naomi, as we like to call her, please do let us know here at the Center for Healing Neurology. You can contact us through reception at centerforhealingneurology.com or via our phone number, 206-379-1213. As of the airing of this show, you are welcome to call and schedule. And you can get all the details about Naomi, about us, our clinic, our services through our website, centerforhealingneurology.com. Thank you for listening. We've got lots of ways to continue this conversation through Facebook, Instagram, and Twitter. And also feel free to send topic requests to podcast at Center for Healing Neurology. We love that you've joined us today to discuss how to make our whole world medicine. We rise or fall together, and we're committed to doing what we can to make as many of us as healthy as possible. And this takes all of us, including you. Thank you for listening, and see you next time.
Partyfish Media acknowledges that it operates and records on indigenous Duwamish and Puget Sound Coast Salish land that is still home to the Duwamish tribe. This land is stolen in violation of the Point Elliott Treaty of 1855. We are committed to uplifting the name of these lands and community members from these nations who reside alongside us. For more information on this land, its people, or ways you can help, visit duwamishtribe.org or realrentduwamish.org.